Hello everyone. In this short video, we're going to look at medicine coding in our CPT manual and go through one medicine practice coding scenario. The medicine codes are in your CPT manual in the back. They start at 90281 and go through 99607. You will find this section in the tabular right before the category 2 codes. The coding guidelines are always at the front of every section in the CPT manual. So if you open up your CPT manual to page 635, you will find the medicine coding guidelines. And again, those are right before the actual tabular list for the medicine codes that start at code number 90281. You always want to look at the coding guidelines as you're coding a section. Just review them, get familiar with what the choices are in the medicine section. As you can see, some of the common procedures that we see in the medicine section include psychiatry, vaccines, hemodialysis, biofeedback, ventilator management, allergy testing, echocardiograms, cardiac catheterizations, and some central nervous system assessment and testing. But I encourage you guys to go through the medicine coding guidelines. Again, they start on page 635 and go through page 638. Now let's look at a medicine case scenario. We're going to code this together. So we have our patient, Billy Biltone, who is a 56-year-old coming in today for a single procedure of hemodialysis evaluation from Dr. Jones. So what code do we assign? Remember, when you're coding CPT, you're coding for procedures, so services, operations. So what is the service in this scenario? Well, it's this evaluation for a single procedure of hemodialysis. So we're going to open up our tabular, look at if there's any coding guidelines for coding hemodialysis. There's not any mentioned right there in the tabular. So now let's go look up hemodialysis in the index. So open up your CPT manual to H and find hemodialysis. You'll see it's on page 994 in the middle section. I know this slide is hard to see, so I tried to make a little bit bigger of the page that you see. So here's the index in CPT. So we're going to go to hemodialysis, and then we want to make sure that we go to procedure with evaluation. So we have two codes to look at, 90935 and 90937. So now we're going to flip to the tabular, look at both of these codes. In the tabular, there are instructions or guidelines about coding hemodialysis. So make sure and read those. I'll give you just a minute. Then look at the two codes that the index told us to go to, the 90935, 90937, and we're going to see which code applies to our scenario. On this slide, I made those two codes a little bit bigger so it's easier for you to see. So if you want to pause the video for 1 minute, decide which of those two codes applies to our patient, and then we're going to share the answer. So the correct answer would be 90935 because that is a single evaluation, where the other code, 90937, was repeated evaluations. So again, make sure and read all the codes given to you in the CPT index for the procedure you looked up. There might be one, there might be two, there might be 10. You need to read every single code provided to you for that term, that procedure in the index. Verify in the tabular by reading every single description until you find the one that matches your scenario. So 90935 matched our scenario because it was a single evaluation. The other code was not.